Hello, mister. My name is David Menendez. I'm going to talk about Pheochromocytoma and paraganglioma. Okay, Pheochromocytomas and paragangliomas, or PPGLs, are high vascular neuroendocrine tumors that arise from chromaffin cells of the adrenal medulla or their neural crest progenitors located outside of the adrenal gland, respectively. These neuroendocrine tumors are classified as tumors of the adrenal medulla and extra-adrenal paraganglia. These tumors are derived either from sympathetic tissue in adrenal or extra-adrenal abdominal locations, or from parasympathetic tissue in the thorax or head and the neck.
This is a concept video on pheochromocytoma and paraganglioma. Pheochromocytomas and paragangliomas are neuroendocrine tumors that arise from chromaffin cells, either of the adrenal medulla or of the ganglia of the sympathetic nervous system. Since pheochromocytomas and paragangliomas are capable of secreting catecholamines, these tumors can be explosive in that their production of alpha and beta adrenergic agonists can result in major symptomology. These include cardiovascular symptoms and diseases, psychiatric symptoms, and an overall decreased quality of life. Further, pheochromocytomas and paragangliomas can be a part of genetic or inheritable tumor syndromes that may be associated with other tumors, may have malignant potential, and therefore should trigger important prognostic and surveillance implications.
Application in medicine. Separate genes and symptoms of PPGLs mainly reflect the hemodynamic and metabolic actions of the catecholamines produced and secreted by the tumors. Hypertension is the most common sign and may be sustained or paroxysmal, with the latter more usual presentation occurring on a background of normal blood pressure or sustained hypertension. PPGL may also present with the hypotension. Headache occurs in up to 90% of patients with PPGL. In some patients, catecholamine-induced headache may be similar to tension headache. Excessive, most commonly, truncal sweating occurs in approximately 60 or 70 patients. The next video.
They typically occur as paroxysms or spells, a sudden burst of a constellation of symptoms that reflect excessive alpha and or beta adrenergic receptor overactivation. These predominantly include cardiovascular manifestations such as tachycardia, palpitations, episodic or sustained elevations in blood pressure, chest pain, and with chronic catecholamine excess, cardiomyopathy. Symptoms can also be neuropsychiatric in nature, including anxiety, panic, and headache, especially when hypertension is severe. Other manifestations include sweating, tremulousness, and abdominal pain. As an example,
Pros and cost. Pros. There is treatment for PPGL. The definitive treatment of PPGL is surgical excisions of the tumor. The risk of operative mortality are extremely low if performed by an experienced surgical team including a skilled anesthesiologist to monitor for intraoperative hypertensive crisis. RFA, external radiation and radiotherapy with IMIBG therapy can be used in patients with the metastatic disease in whom surgery may not be feasible. Cons. Exposure to high levels of circulatory catecholamines during surgery may cause hypertensive crisis and arrhythmias, which can occur even when patients are preoperatively non-retentive, and asymptomatic. About 10% of pheochromocytomas and 25% of PGL are malignant. PPGL typically metastases to lungs, liver, bones, and lymph nodes, and patients with metastatic disease suffered from diminished quality of life due to localized pain caused to metastatic consequence of critical mind exists, and of course, treatment side effects. The next video. Okay, you should apply it in Ecuador. Pheochromocytomas and paragangliomas, or PPGLs, are highly common. Are these cases all over the country and medical thanks to the recent treatments, so it's not a fatal prognosis in most cases. Next video.
The treatment for pheochromocytomas and paragangliomas is surgery to remove the source of catecholamine excess. Preoperative medical treatment is necessary to substantially reduce the risk of operative and postoperative complications. The goal of preoperative medical therapy is to block peripheral effects of catecholamines to minimize excessive intraoperative alpha and beta adrenergic agonism that may result in severe hypertension and tachycardia that could cause end organ damage, while simultaneously minimizing the risk for postoperative hypotension. Therefore, the key components to preoperative management include the identification of a surgical and anesthesia team that has ample experience in the hemodynamic complications of removing a catecholamine-secreting tumor, treatment with alpha and beta adrenergic receptor antagonists, and volume expansion with salt or saline, since catecholamine excess induces a natriuresis and volume depletion that can increase the risk of postoperative hypotension.
Okay. Conclusions. PPGLs are neural crest-derived tumors, and currently more than 40% have a known genetic cause. Thus, all patients with PPGLs should be considered for genetic testing. Disintegrated neoplasms are rare, and many clinicians will never encounter them. Nevertheless, it is important for clinicians to remain vigilant and to resuscitate, confirm, localize, and resect these tumors because the associated symptoms and interpretation are curable with surgical removal. If the tumor is not diagnosed and removed, there is a risk of lethal paroxysms and cardiac disorders. These tumors have malignant potential, and early resection is the way to prevent metastatic disease. Next video.
Form in the adrenal glands on top of the kidneys. Paratumors form outside the adrenal glands on both sides of the spinal cord.
The unique feature about neuroendocrine tumors in general, and pheochromocytomas and paragangliomas in particular, is the hormones that the adrenaline and also noradrenaline also they can produce these huge excessive levels. When they produce them at the excessive levels, the hormones get in the bloodstream, hormones cause a variety of symptoms.
Pheo and para are caused by an inherited genetic mutation more than any other cancer and can affect both men and women and people of all ages. While most people are in their 40s to 50s when they're diagnosed, the disease can affect children and the elderly.
Thank you very much.